A very good morning, good afternoon, and good evening, ladies and gentlemen all over the world. It's your friend Royal Mark again, and I love you so much. I can't stop loving you because of the love you have showed me. Thank you for subscribing to my YouTube channel. Thank you for following me on my different platforms, TikTok, Twitter, Instagram, and Facebook. Otherwise, I still remain your friend Royal Mark, and I'm still bringing you the best information that has been researched. Now today we're going to talk about UTI, or what we call urinary tract infection. This has been a complaint all over the world, not only in Africa, though in Africa it has been rampant because of mainly sanitation and environment. People do not know how to use the environment. People urinate anywhere they feel like they want to urinate. People dispose of anywhere they feel like they want to dispose anything. But today we want to know what is urinary tract infection. Now, urinary tract infection is an infection that affects the urinary system. And in our urinary system, we have two kidneys, we have two ureters, we have a bladder, and we have a urethra. And each of these have different functions they do offer to the body. And to the kidneys, most especially, they are the ones that are so much important to the body, to the extent that they help to help regulate the body on high blood pressure, or to maintain the blood pressure. And also it helps us to secrete the unwanted wastes from the body. Now, to go further, we want to know, yes, we have known what UTI is. How many types are they? We mainly have two types of UTI. According to what your doctor told you, today you're going to understand. There's what we call the upper and then the lower, where we have the lower is composed of your urethra and your bladder, and then the upper is composed of your ureter and the kidneys. Now, which are the people that are commonly affected with UTI? Now, pragmatically, it has been found out that UTI is more common in women than men. Why? Because of their urethra. It's short, it's just 4 centimeters. And then for us men, ours is 25 centimeters. Sad enough, it is just proximal to the anus of a woman. They are near, meaning it is easier for the feces to go into the vagina of a woman and making her begin getting infection of the UTI in her vagina, compared to the men, whereby the anus is too far away from the penis. So this is why you find that UTIs are more common in women than in men, just because of anatomy. Now, what are some of the predisposing factors, or what are some of the causes that can easily make us have UTI? You know, it could be a bit a longer video, but I want you to understand today that hormonal changes can make you have UTI. For example, pregnancy. When you urinate all the time, you're predisposing yourself to get the infection of UTI. Every time you go to the toilet, you predispose yourself to getting UTI. 2, lowered immune system. We find that people who are having a low immunity system, for example, people who have HIV/AIDS, people who are cancer patients and they are bedridden, their immunity is low, they tend to have UTIs. And then catheterization. This goes to the nurses in the hospital, or to the doctors, or to the clinicians that do carry out catheterization to the patients, that always make it sterile. Put a catheter in a very sterile manner, because while catheterizing the patient, you can introduce the bacteria into the penis or into the vagina of the patient, and you do cause the patient have a urinary tract infection. Then the other thing I'd like us to talk about is toiletries. Toiletries are, for example, I would like to talk about women. When you are in your periods, how often do you change your pads? Despite your busy schedule at work, make sure at least at least an hour or two, change your pad. Or when you feel like your pad is full of blood, go and change it, because this is going to expose you to getting UTIs if you do not change your pads oftenly. Now, excessive use of antibiotics is another thing I want us to talk about. You know, in our country, Uganda, and Africa at large, we have what we call poor health-seeking behaviors, whereby a person goes to the hospital once, and when he's told that you have a UTI, you're going to use this medicine, they will never go back to the hospital. So they will begin treating themselves even before seeing a doctor or before seeing a clinician. This will predispose you to getting a chronic UTI. You know, even UTIs have different types. You have acute, We have chronic and acute on chronic. So many people undergo different types of UTI just because of irrational use of antibiotics. So before you begin treating yourself, consult a doctor to tell you either still it is a UTI, is it a cystitis, is it a pyelonephritis, or it's just a nephrotic syndrome before you begin treating yourself. The other thing I would like us to talk about is diabetes mellitus. Now, diabetes mellitus is just a blood sugar disorder in the body. This one will help or will cause you go to the loo most of the times. And remember, where there is glucose, there is water. And where there is glucose, there is bacteria. Bacteria come to feed on this glucose. And as a result, you're going to be having more often the UTI affecting you. The other thing I want us to talk about is renal stones. Renal stones, these ones will obstruct the flow of urine. And because they are going to block the flow of urine, there is going to be what you call stasis of urine. Urine is going to be kept. Remember, when you go to urinate, you're urinating the dirt, or you're urinating wastes from the body. But if they are retained in your body, it means you're going to get the urinary tract infection. Lastly, what I would like to talk about our causes is over distended bladder. If your bladder is distended, it serves as an environment. It serves as a place of bacterial growth, and as a result, you're going to be having UTIs more oftenly. Now, somebody is going to ask me, now, what are some of the signs for me that I can look at to know that maybe I have a UTI, and then I run to my doctor as quick as possible? These are some of the signs, my friend. Number one is pain on urination. If you're urinating and you're getting pain, begin thinking, I could have a UTI. What do? Don't treat yourself. Go and see a doctor to do some tests, as we shall see at the end of our video. Then the other is fever. Yes, when you have a UTI, what we call hypothermia in scientific terms, yes, you tend to have high temperatures. Your temperatures will go high. When you touch yourself, you feel like you have a temperature. Please, also to the babies. Babies are getting UTIs mainly because you put them in Pampers and you don't want to change them. Let me go back to that point. So our children today are suffering from UTIs because you don't want to change their Pampers. When you calculate that now your baby pamper is full, please change it. And avoid putting children in Pampers day and night. Why? At least during day, let the baby not be in a pamper. Let them urinate normally. And maybe at night when they are going to sleep, you can put a pamper. But don't put babies in Pampers 24/7. This is why your child is going to always have UTIs. And it's now very common in children just because of Pampers. The other sign that we can look out at is odor. Yeah, odor or smell. Sometimes when this UTI has grown, this urine is going to have an odor. Yeah, it's going to have some smell that may not be good to listen to. Most especially when you urinate, you're going to feel that smell. When you begin feeling a smell when you're urinating, begin thinking, I could be having a UTI. Now, this one is to the doctors or to the clinicians. When you go to the hospital and they test you, you're going to have what we call increased leukocytosis. These are white blood cells. Why are they in urine? Because they are trying to protect you. Because remember, white blood cells protect our body against infection. Now, why you're finding them in urine? It's because they are trying to protect you from getting the infection, which is has already occurred. So they are showing you that we have been overpowered. Please give us medicine to assist us. Okay. Now, lastly, what I want you to know, most especially people who are in a hard-to-reach countries, whereby it could be hard for you to see a doctor, most especially in some of the African countries, and you can easily find a lab. These are the tests that we can do. We can do what you call urinalysis. Most especially the first stream urine, we can do urinalysis. Urinalysis is to look at the bacteria that is causing you have UTI. We can do also urine culture. And lastly, we can do a cystoscopy. And a cystoscopy, mainly this is just to visualize your bladder and get to know what is mainly causing maybe a cystitis or what is causing you have a UTI. I want to end this video by saying hi to my friend Dr. Nabunwa Godfrey. I love you so much. When I talked about cystoscopy, I remembered you. I love you so much. He's a good rheologist in Uganda, working in different hospitals. Otherwise, I love you, Papa, wherever you are. I dedicate to this video because I'm what I am because of you. And I want to also dedicate this video to all the people that have subscribed to my channel. Thank you for subscribing wherever you are. Continue subscribing for the best videos. They are coming researched, and when they have been been verified that this information is going to help you. I know this has helped you. Let it not help only you. Please like, comment, and share. And when you're watching this video, make sure you watch it fully to help me gain out of it. And also, if you want to know more about me, you can also follow me on my different platforms of TikTok, Facebook, Instagram, and Twitter, whereby I use also the same name. I remain your friend's Remark. May the God that protects us also protect you wherever you are and keep you from all dangers. May He cause what you want, what you have been fasting for. For example, my friends are Muslims who are fasting in this period, and also my other people that are also fasting on their own. For example, the born-again Christians, for example, the Catholics, and then the Protestants. I love you all without segregation. May God protect you and bless you wherever you are. Be blessed, and bye-bye.